For 17 years, his body showed no pain, no fever, and no warning signs. The injury healed, the scar faded, and life moved on. But something inside that scar never fully died. The scar looked normal and never caused problems. No doctor visits, no medication, and no reason to suspect anything was still there. At 22, he cut his leg on rusted metal at a construction site. It bled but seemed minor, and he expected it to heal like any other cut. The wound was cleaned, stitched, and monitored. Then it closed, and the event became a forgotten detail from a job years ago. Over time, the scar softened and blended into his skin. Nothing about it suggested danger or infection. For nearly 2 decades, nothing happened. The body stayed quiet and the scar stayed silent. At 39, a dull discomfort appeared near the scar. Not sharp and not sudden, but a pressure that felt deeper than skin. The pressure felt like something pushing outward from inside the muscle. Yet the surface looked unchanged. There was no redness, swelling heat, or tenderness. The leg looked normal, and that made the symptoms harder to explain. Doctors suspected nerve irritation or tightening scar tissue, a reasonable answer that matched what they could see. Medication was prescribed and the symptoms eased, and it seemed like the problem had finally passed. Months later, the pain returned stronger and more persistent. Walking became uncomfortable and standing increased the pressure. Blood tests showed no infection. White blood cells were normal, and there was no fever. The usual alarms never appeared. What worried doctors was not what they found, but what they could not explain, because the symptoms did not match the surface. Then the scar changed. The skin separated slowly without trauma, and released clear fluid without blood and without odor. Doctors considered delayed wound breakdown. Rare but documented. Yet the depth of the problem felt different. Beneath the healed surface, something had survived without spreading or triggering immune defenses, hidden far below the visible scar. Some bacteria can slow their metabolism to near zero, hiding inside scar tissue, muscle, or bone where antibiotics and immune cells struggle to reach them. Surgery removed damaged tissue, and lab cultures confirmed a living bacterial colony consistent with the original injury exposure. Left untreated, it could have spread into bone-making amputation likely. The wound healed once, but the infection remembered. And sometimes the most dangerous infections are the ones that already survived you.